Show you a little bit of what we do here at Total Health Center as part of a patient's therapy. We do a little bit of manual therapy, therapeutic exercises. We have a lot of modalities to help a patient. One of the things that we do that a lot of places don't do is cupping. Cupping is the use of suction cups or glass domes to draw the tissue up inside the cup. So I'm going to show you how this is done by applying it to certain points along a person's shoulder blade. Create suction so that the tissue stops inside the cup. The traditional method is where they heat a glass dome and then place it on the tissue, and as the air cools, it shrinks and draws the tissue up inside the cup. We use a suction cup here because fire and liability insurance don't match when you're dealing with patients. So we use the suction cups to create a stretch within the tissue and the fascia. This also creates a negative pressure where it draws the pressure away from the person's body. So if there's a very, very tender point that it doesn't allow us to push in and work on that, we can actually draw it away from the person's sensitive structures and create a release of that fascia. As you can see with the cups, this person has a very good histamine response, meaning that there's a drawing of the blood and the redness of the tissue, which signifies the blood flow increase. As the blood flow increases, it helps with relaxing the muscles and also delivering oxygen and other healthy nutrients to those muscles as that cup is stretching that. Another technique with the cups is to perform gliding of the cups, where we apply some sort of lubricating medium. In this case, it is Vaseline. You can use lotion, but it also gets absorbed in the skin faster than the Vaseline does, because you want that cup to have a nice free movement over the skin. So once I have that spread around, you apply a slight suction force so you can still move the cup smoothly and easily over the surface. See how it's creating that red line of that histamine reaction? And that friction within the skin really stimulates that blood flow. And this works really well when a person has really, really tight ropes in their back. Also works really well on the IT band syndrome, as well as on the shoulder blade muscles where the person's had really chronic knots and tensions within those areas.